Wait a minute. What time are we starting?
I was just about to text. So the agenda says 6, but the Zoom said 6:30.
Right.
I
And
thought 6. I thought 6:30 was a
I
one-off.
thought 6 too. And I said, oh God. And I said to Anthony, I was like 6, right? And then I went to get on Zoom and it's like, not till 6:30. So I'm surprised it's just popped on. So I didn't realize I was. I
was like in the middle of sending a text to you guys, like, what's going on? But the agenda said 6. We're usually 6. It was even 6 last week, though I thought it was 6:30.
I know. I'm so all right.
Is Elaine around, or do we know?
I don't know, but
Cindy, are you on?
I think people probably looked at the thing and then switched themselves to 6:30 because I got on at 5:06 and then I was like, oh, it's 6:30. What the hell?
Right. How did this open? Did you like?
I don't know. So that's what was really funny is so I'm on my work computer, so probably that's all right. My name's there. And I went in, but then I saw that it was 6:30. So I thought I got out and then all of a sudden you popped up and I'm like, what the heck? I'm so confused. So maybe it was just waiting for the host to open. Are you the host?
I am. I just like became the host, but I don't think I turned it on. I don't know what's happening. I'm out. Okay.
We're being recorded, so I won't. It said we would be getting recorded, but maybe not. I don't know.
Make a motion.
Good.
Elaine, was that a motion?
Yeah, I'll make a motion to accept the minutes from the January 18th meeting.
I second that.
All in favor?
Aye,
Corbin,
Silva.
Linehan, aye. All right, so moved. Excellent. And then next on our agenda, we have the body art, we have the fee schedule, we have the voc, we have Anthony's report. Do we want to go in that order? Any feelings about changing that order?
No, go. It's proper to follow the agenda, right? So am I opening my body arts? Is that what you're telling me to do?
Yeah, you should do that then.
Okay. Oh, 2018. What a good year. It's all coming back. Okay.
That's pre-pandemic.
I know. So between grad school and Board of Health downloads, I have no memory in my computer. So can I put in for a Mac? Any more? I think the board members, if you're going to keep them offline, have to have a computer.
We'll put in a request in ARPA.
Yeah, you do that. Okay. All right.
Okay, so body art regulations, is that where we're starting?
Yes, please.
Okay, so we're gonna keep this short just because there's still a few changes coming. But one of the things that's been put before us more recently has been microblading. So every community, including the last meeting we had in Stoneham for the Board of Health, same issue. We just need to kind of figure out where we want to put microblading. It's kind of a gray area. It doesn't really quite fit into tattooing. It's temporary ink under the skin. So it's, there's nuances there. So right now what we're doing is we're gathering as many body art regulations as we can find in local areas and just seeing who has the most, up-to-date kind of research, evidence-based practices on microblading. We're also about. Yep, go ahead.
I'm sorry. Do we have a reg for micropigmentation, or did we not do that the last time? Do you remember, Laurel? There was a discussion.
I know. I thought we did do microblading, but
yeah, because we didn't want to do. I had micropigmentation, but we did not allow microblading, and I know at that time. We went over them, but I thought we had accepted the microblading instead of micropigmentation here.
Yeah, I thought so too, because we actually had an establishment help us out. They were very helpful. I would have to go back. I remember who the people were, but I don't want to. And industry certainly has been ticking up. I'm looking now. So Anthony, you're telling me microblading's nowhere in here?
No, it's in there.
I
Oh,
think
it is.
we
Right.
do have microblading regs, but I think it might be time to kind of evaluate again, whether they're suitable for what we're doing right now. There's a
All right.
question about the education piece as well.
Yes,
Oh,
I think
Yeah,
that was the
yeah.
problem.
I mean,
with
it's
that,
all
yeah.
coming back to us. We're like, do they really need anatomy and physiology? All right.
Yeah. So one of the
Where is
concerns,
it though?
it should be in there, Cindy. I think it was part of the stuff we sent out, right? Is that right?
I know, I'm just wondering what page. It's a 23-page document.
Oh, yes, it is. It is.
Yeah, here it
extensive.
is, an anatomy and physiology course or other relevant courses deemed
Yes.
acceptable. Oh, yeah, that's kind of mean. All right.
Yeah. So I think one of the things we're trying to figure out is, we do want people to be well informed and know what they're doing when it comes to safety and, practices. But I think the other thing is somebody from the body art community in Stoneham brought up a good point. Some of these goals may not be realistically attainable for somebody who might have practiced in another country, somewhere else where the regulations weren't the same. So, when we set the threshold too high, people just can't meet it. They end up just practicing without us knowing anyways, right?
Yeah, page 20.
So,
Yep.
yep. So it's almost like we have to kind of, and I think it's on us to kind of do some more research, talk with people in the industry, to kind of figure out what's a acceptable level of balance of education and experience, and not to create more work for a case by case basis for the board. But it's almost like, when someone comes, before us and has, say, X number of years of experience, can that substitute for certain requirements, that sort of thing. So
I don't know. I really liked what we set up. I would just like to know. So I'm looking at it right now.
yeah,
So the world is a little over credentialed. I'll admit it. That, like we just keep layering credentials. But why do we do credentials? It's like part of quality assurance.
sure.
And, so we worked with providers in Wakefield who are, were really super careful, and they're the ones who gave us the guidelines. What I think may need to happen is we just need to revisit whether the American Academy of Micropigmentation still exists, or even the Society of Permanent Cut. Like, we just kind of need to know what's out there for training. And so I kind of feel like we should go to our registrants or licensees. I mean, it would be nice if all of this was under a straight on to, Massachusetts. That's the other thing, is this ever moved? Like, has cosmetology moved over to a Mass state license like estheticians have? That's,
There is a board of cosmetology and barbering. Those fall under the same one. Yep.
so I think it was so new that like, has that changed? That would be my question. Like, are the state regs around the licensure for aesthetics and barbers and hairdressers, I forget, it's a better name, and stylists, is that now including this or not? Because if it is, then we get to go, oh, it's on the state.
Yep.
Yeah.
I don't believe it has. There's been a need for change for a while, just to update their regs, but from what I understand, they're not included right now.
Okay.
Yeah.
I think we could start kind of a column in our notes on on a check with our state rep or senator on these things, because there've been a few other things that I feel like we're powerless to do, but I think it would be good to, maybe utilize our local legislatures and in regards to, hey, of these regs, who's looking at these regs, who's a legislator who's, involved with DPH, for instance. It might be a nice shortcut, but it also would press them to understand that local municipalities are grappling with this, and we, let's use our time effectively. If they're going to take it on the state, then we need to have some input. I'm just responding to that nice letter that we just got from Jason Lewis saying, and I'm working on this and this and this. I'm like, oh, well.
A lot of it is, though, in the history was that the state didn't want to take on tattooing and microblading and all of this.
Right.
Well, including that body work too.
Body work. So that's what happened to us. And then everyone kind of went according to Boston and Cambridge, and like we
Right.
did in Everett, we kind of adopted them. And then the training for all this, especially in your pigmentation, the place that used to teach them in Quincy closed, the woman retired. So
Mm.
someone came along and started a whole new institution where people could go for that.
Yeah.
And the microblading really wasn't popular here. It was brought in here from a couple of other countries. So that problem with them was, Anthony, they couldn't prove what they had done. And that
Right.
was the big thing. So each city and town kind of wrote their own thing of what they were going to follow for in regards to the education and like a internship. I know we had internship. That's what we had. We did it that way. They had to work for so long. They applied, for to be like Underwood, and then they would go to a establishment and they would go for so many weeks, and then they would be signed off on what they could do, and then they would get a permanent license. Because we did have that one facility. I don't even know if they're still in business. I don't think they are. Come to think of it.
Which one?
The people who approached us for us have a booming spa right now.
Do
on
they?
Princess
Is that what
Street.
they're doing?
Yeah. I mean, I don't know if
Um,
that's still part of their practice. Yeah, Cindy, do you know with our,
Bellamano was the woman that came, I believe she's not in Wakefield anymore. I would know,
Hmm,
if she had a permit. I think the only, Eva, I think she came to us as well. She has a practice. She does microblading. And we have another one on Albion Street. I think it's called Glitz.
mhm.
We might have two. Can't keep them in line, but I think there's 2 or 3 right now going with microblading. Albion Street, Salem Street, and the one next to Noah's. 3.
And do they demonstrate what we have on the
Yes,
books right now?
or
Yeah,
else they wouldn't have got the permit.
right.
But I think our regs, what we did in it back in 18 was we did pull from, I think we pulled from Quincy and Peabody and Cambridge, and they're just kind of jumbled. So I think what we're
Okay.
trying to do is
You want to clean them up?
fine tune them.
So any input you guys might have between now and the next meeting, well, what we'll do is we'll take that into consideration, and any other input we get from other towns looking at their regs as well.
Yeah, I mean, I guess I would like to, I would like to see one of the licensees like
Yeah.
red pen the thing and tell us what either is out of date, whether there's an improved practice, a standard of practice, and whether they think it's arduous. Like I kind of feel like we need a provider to take a look at this stuff and go, huh,
I'm actually forgetting the biggest establishment is Shine
yeah,
on Princess Street.
that's what I
They
was thinking.
came, they were I almost think they were the first ones.
Yeah, they helped us
Yeah,
write
they
it.
were.
Yes, and that now she's actually doing an apprenticeship.
Oh, maybe we should talk to her then.
Yeah.
Yeah.
Maybe should we invite her to a meeting or talk to her offline and
I'm happy to send out an invite kind of to her, and we can talk maybe between now and the next meeting, and then I can bring any changes that she thinks might be appropriate. We can discuss the next meeting, kind of like well, I guess not a public hearing, but a change in probably a
Like-
change in policy. So we'll have to make it a public hearing.
Yeah.
Well, and I would even just ask her, hey, is this still,
Yeah.
I mean,
I don't know if,
are we getting that many complaints that it's outdated?
No,
No,
yeah,
we're
where did
not.
this come from? How did this
this-
come to our?
This was more so when we were having a discussion with the Stoneham Board of Health. They were looking to adopt body art regulations.
Oh, okay.
And so we were going through, we use Wakefield as the example regulation for them to look at. And there's a couple of things that we wanted to kind of clean up. And I figured, since we're already doing it, might as well take a look at some recent practices and I'll update them.
Is there anything particular in this body of 23 pages that you think needs revision? What's
Not
up?
at the moment. I mean, it's mostly the education piece that we just want to make sure everything is still relevant.
Yeah, so
yeah.
I would definitely, Anthony, go visit, Shine. I don't have time to do it.
Oh, I was gonna send you.
No, I know. I do need some work.
You could get microbladed while you're
I-
there.
I
Yeah, oh,
have,
yeah.
I have
Agreed.
eyebrows. That's not the issue. Yeah. I did a few things removed and lopped off, but, I know, I would love to, but yeah, I don't want to put ourselves in a, I don't want any conflict of interest, so.
But maybe if we, you mentioned a public hearing, if any of the other practitioners of this in Wakefield would be willing to come, like it could be a little bit of a round table,
Mhm.
That could be a great idea.
which might be useful.
That's why when we redid our regs, we invited them all and we had meetings for like 2 or 3 meetings with them and then sat down and took everything from them and then took from us and then put them all together. It worked out well.
I think it'd
this is
be
it.
useful to stay focused though. If we have folks like, all right, we're talking about microblading. We're not talking about any other, and
Yeah.
we should have like 1 or 2
So
procedures.
if we were a bigger board, I would recommend a subcommittee take this to commit, like, we never do this, but we could. Other boards do this, where this becomes a a short-term subcommittee of one who, just kind of does the meetings and then, we can do it one of 2 ways. A subcommittee of one where one of us and a health department employees, search these folks out and invite them to something and then report, or we just have a free for, or we just do the open format meeting. Maybe the open form, maybe it's more expeditious, but
Yeah, let's just,
we'll just do it that way.
yeah. And then maybe it'll make our conversation simpler when we go forward. So see if we could invite the person that does the procedure on Princess Street and
Yep.
yeah, maybe let her know if she's like friendly with other folks in the area who do this, like, hey, we're gonna have a meeting.
Mhm.
Would you guys be interested in coming and having a conversation and making sure folks know that we're not out to sort of like come after anybody? We just kind of want to have a conversation about
Well,
what makes
you also,
sense.
I think too, if you just sort of acknowledge, listen, we with your help, we put together the regs in 2018.
Yeah.
And we're assuming that there's been change of practice. And so we're
You think you
wondering-
know best, so we'd
Pretty
appreciate your opinion.
Yeah, I mean,
Yeah, there-
she's
yeah.
she's like a med spa, so,
Yeah.
the body, everything else that she's, all her licenses and permits of the state, and so for
That's
just
right.
to
She
have that
hired a nurse. Yep.
one permit being her body art, it's like, but yeah,
That's true.
I think she'd be all about it.
Yeah. That's
All
right.
right, so who's volunteering to come with me?
I'll go
I'll
with
go.
you.
Maybe she'll tweak me.
I don't want anything done, but I've done the regs
I
before.
could go
I
with
did
you on a,
inspections.
I could do a Tuesday after tennis or a Friday morning after yoga.
All right, I'm holding you to it.
Hey, Catherine,
Okay.
All
I
right,
could come
so
too. I'm available like at random times, so if they can't, I can fit something in.
You can try
Perfect.
me. I used to do the inspections for all the micropigmentation and all.
Oh,
the testing.
geez. Well, baby.
That
Oh,
was
right.
mine.
Well, you
Are we
always
asking-
win.
Good
are we
job.
asking for help or are we doing inspections? Okay.
No
Um,
inspecting.
Yeah, we're
No
doing
Social
inspecting,
visit.
but it's a
Social
good thing
visit.
when you go in for a social visit, when you look around, what you can see. It's really, really interesting. It is interesting.
Mm.
Okay, that sounds
Laurel
good.
is Jojen Locke, you're
I don't recognize that name,
okay.
but maybe.
Do we want to ask if that person's here for just to observe or?
Jojen Locke, could you identify yourself, please?
The Barbara. Hello.
Might just be an observer.
I know. Well, I had a host disabled person. Oh, that's weird. I don't know what that means. They're on. Oh, what happened to Jojen?
They're still
It's
there.
still there.
They're still there.
There we go. Jojen, who are you? Is that Barbara or is that somebody else? Huh. All right, fine.
Okay.
All right, so that sounds
Any
good.
more
So
body work for, excuse me, microblading for now? Is that
No, I just wanted to bring it to your guys' attention that we're looking to kind of update them. It's been 5 years. So it's time to kind of look at them and see if they're still good to go.
All right.
Would it be, I know we normally kind of go in order of the agenda, but since we have Catherine here, could we maybe move her portion up so we can do updates?
Sure.
What question is that, Kat?
It was going to be in the health director's report, but
Oh, yeah.
Catherine's here because she has a lot of updates and a lot of great programs. So
All right,
I wanted to
go.
make sure that she gets a chance to go. So.
Hey, Catherine.
All right, so Anthony asked me to just come in and give some updates of what's going on with wellness, prevention, and social services. So I'll give you a few updates on everything happening there. So good news is we're just awarded the 3rd year of the Melrose Wakefield Healthcare Community Health Impact funding. So that's what funds our social service networking events that we've been hosting, and really to support our new immigrants and residents, to connecting them to local inclusive services that directly impact their social determinants of health, and really also improve community connections for new residents. So that's one of the things that we're doing with that year 3 of that grant. So it's about $13,000 that we share between Wakefield and Melrose. Jason, our social service coordinator, is super busy. Over the past 2 months alone, he's worked with 50 Wakefield households, and he is helping to coordinate our new fuel assistance program. So he's helping to assist them into the LEO or the Good Neighborhood Fund. They have to qualify for that before they can qualify for our town program. So once they qualify for that, they they're applying for the Wakefield program, and that gives them, if they're Wakefield Gas and Light customer, they get a $500 check cut out to their Wakefield Gas and Light account, and $750 for oil companies. So it's just been a lot getting this program up and running. We have about 20 residents who we process payments for, and another 50 that are waiting on their payments, and then more come in every day. I think we had 3 or 4 applications come in today for the new fuel assistance program. So that is occupying a lot of Jason's time. Our recovery coach is busy working with approximately 20 Wakefield residents right now and their families. And we're looking at the opioid funds to see how we can support her work. Even just today, she came into the office to pick up some track phones for some of the individuals she's working with, getting them access to recovery and support services. On the prevention front, we're Wakefield's hosting Parent University. Laurel, we saw you at the first keynote last week on processing speeds. We got another virtual keynote in a couple of weeks, and then our event is back in person at the end of March. So Amy and I are both on the planning committee for that, working with the schools closely. We're piloting a couple new programs at the Galvin right now. One, we're moving our successful diversion program down to the middle school because we've had 3 or 4 situations of students caught either under the influence or with substances. So we're piloting a middle school diversion program, and that's funded under the opioid settlement funds. And then we've had an uptick in hate speech and acts at the middle school. So they proposed to us a diversion program around that. So that's being piloted right now with 2 of the middle school teachers, and that's funded under the Stop School Violence grant. We're also currently running the screenings in the schools. So we're doing the SBIRT, the screening, that's the substance use screening with all 7th graders and 9th graders. So we were running around getting supplies for that today. And then the signs of suicide screening we're doing with for depression and anxiety with all 8th graders and 10th graders. So just supporting the teams on administering those. We are also working on administering the youth risk behavior survey again this year. Brendan and I have been working with the school this week to finalize the tools, and that's in conjunction with the Middlesex League. So we're excited that we don't have to pay for that again this year. It's funded by Leahy and our Mass Call 3B grant. So we'll be able to have that data probably in the summer. So I'll come back and report the findings of that. But today, this week has been really figuring out what extra questions we want to add on and finalizing that tool. Our youth action team is super busy right now. They've been running their middle school and high school clubs. They just did a really cool distracted impaired driving campaign. If you follow them on social media, you saw the lifesavers that went on over 200 cars at the high school to remind students to not drive high, because that we saw those numbers up significantly. And the Galvin just had their Family Feud for the 9th time, I think. And then on tonight on Fox 25 News, 2 of our youth action team leaders will be on there on a segment taped earlier last month around the impact of COVID and youth mental health. And finally, Candace has been working with Alexis on the later school start time. So they had a wonderful presentation to the school policy subcommittee a few weeks ago. And between kind of Alexis's presentation and then Candace's kind of advocacy for the public health impacts, it was really successful. And I feel like that they're going to take it to the next point, take it further. And then we've been submitting some grants to fund some things. So I worked with a team from the Wakefield Education Foundation to apply for either 100,000 or 500,000 from the Cummings Foundation to evaluate, expand, and improve our social emotional at the programs at the whole Wakefield Public Schools. And then we worked with Amy to apply for a WAVE Cummings grant. And then the youth action team just got a grant too from the Cultural Council to do mental health education. And then currently Amy and I are working on the Stop Act grant to address underage drinking. That's $60,000 a year for 4 years. And because our drug-free communities is running out in September, we need funds to support her position. So that's the goal of that. And then finally, we have a couple collaborations with other departments. Sorry, my house is a little loud right now. We're running a camp with, can you hold on a sec? We've got a health rec and police camp that we're doing in June. We're doing some Alzheimer's and dementia friendly workshops with the Council on Aging, and actually one of our youth action team members is getting involved with that. Continuing to do work with the Safe Streets Working Group and master planning to make sure that we're prioritizing walking and biking and health opportunities in the community. And Kara actually just wrote a grant for to look at health inclusion. So that's in partnership with Stoneham, Melrose, Wakefield, and Linfield. So what it does is it pays for an assessment, and we're going to be working with the Commission on Disabilities to identify 2 places where they want to do a complete assessment on accessibility to active living spots. And then finally, we are about to debut our first HHS newsletter for the winter. So that'll be in your inboxes in the next day or so. And Lily, our intern's been working with everyone. So you'll see an employee spotlight on Dan and information on all sorts of things ongoing in our department. So that is the update for me.
Thank you. That's a lot. You guys weren't
Good.
kidding.
To think that we were all doing that work in one little office 10 years ago. It's amazing, amazing growth. And that, the DC, the drug-free community grant. So our total was 10 years, right? 5 and 5. Yeah. So that, now we've had, we've gotten used to the good work we've been able to do with that. And I think we've proved our point. As to now we're kind of invaluable, but again, you guys are the grant monsters and the town should be so grateful. We're grateful, but the town really should be grateful. We know what you do.
I was gonna say first, I want to say, thank you to Catherine for all the hard work that she's put into all this. I mean, none of this is possible without, without all the hours you spend, and also Amy as well, obviously Amy and Jason, the whole team. But just, these grants are obviously very time consuming, hard to manage, especially also balancing writing for these new grants, right? So it's a continuous process, and not to mention, actually it might be good if we take this next item also in the same, right after this. So Catherine's been working on our budget, our presentation to budget, both finance committee and town council. So it might be good to jump into that. But again, a lot of this work is only made possible because Catherine's been working so much on this recently. So thank you. Were there any questions on the updates for what Catherine just gave us? I think it'd be good because Catherine, you're still here. We can jump into the presentation you worked on, and we were hoping to get some feedback from you guys on the presentation we're making to finance committee and town council before we go before them, to see if we can kind of show anything else we're doing this year. So.
When is that? When is the presentation to those folks?
I'm almost certain it's the end of the month. I think it's the 27th, so the last Monday of February. I'll get confirmation on that, but obviously you guys are welcome to come to the meeting as well. But I think that's the town council meeting, and then we meet with finance committee sometime in March.
I never understand why it's in that order, but
Well, it's subcommittee, town council subcommittee first, and then finance committee, and then we go back to the town council with a recommendation.
I think it's
that's how it
finance
works.
subcommittee. Not
Yes,
town-
oh, sorry, you're right. There, well, town
finance
council's first.
subcommittee. Yeah.
There's town council subcommittee, then finance subcommittee, then finance full committee.
Oh,
and
that's
then
new.
town council.
Town council subcommittee. I don't
think
recall
that's-
that being
I
part of
think
the
that's
party
new,
in the
right?
past. Do you,
Yes.
Candace? What?
That was the
remember
new
there's
one last
two.
year. Yeah, two.
Yeah, we definitely to FinCom, and then I feel like they were the ones that sort of had to give it the thumbs up, and then it was almost just like a formality to
Yeah.
present it to
Yeah.
the town council.
Yeah.
Yeah.
But there were just two. Are you saying there's 3 groups now we need to?
Wasn't there a third one last year for
pretty-
some reason or other? They did a subcommittee for finance.
Finance had a subcommittee, because I was all
Yeah.
confused when I got on that Zoom. I'm like, where'd
Yeah.
everybody go? And it was just 5 people on the finance committee.
You're right.
very,
It was
confusing.
finance subcommittee and then full subcommittee. So I
Yeah.
think it was 3. I think I listed.
Just send us the dates.
Yeah, please do, I guess.
I
right?
will make sure we get the full dates. I'm pretty sure it's the 27th for the first committee. So also we'll have links for it anyways, because it's all virtual until full town council, which will be in person at WCAT.
All right. Yeah, I need to set up childcare for that stuff, so just let me know.
We'll let you know in advance.
Thank you.
Okay, and then also I think it'd be good to share the presentation Catherine's been working on. Can I potentially have screen sharing access?
Oh, no.
I'll just read it off. It's fine. You guys can
No,
imagine. what it
oh
looks like.
God, no. I need visuals.
Oh my gosh.
Okay, hold on a second.
Making the co-host?
Make co-host. Go.
All right, let's see. Okay, looks like it's working. I'll share the presentation. All right, you guys can tell me if you guys can see it or not.
Yep.
You can see it.
See it.
I need to make it.
And this is a draft, so if you
There we
notice
go.
typos, send them my way.
Oh yeah, absolutely. Is this big enough now?
Yes.
Yep, that's good.
All right, sounds good. So we're gonna start off with one of our biggest points from last year, environmental health. And so, as you guys know, before this year, we had one full-time health agent in Coral, and she was the senior health agent. We also had one shared inspector, and I believe it was Ivan at the time. And since then, we have now one full-time in Melrose, one full-time in Wakefield, and Erin is our senior health inspector, and she's shared between the 3 communities now. Stoneham is also getting one full-time health inspector as well. So just based on our risk-based inspection schedule set by the FDA, We know that different risk levels require different number of inspections. Level 1s, most of your convenience stores, low risk inspections once a year. Level 2, an example would be like a catering business. They require 2 inspections a year. 3 would be any standard restaurant that works with raw food preparation. That would be your 3. And 4, level 4 risk levels are nursing homes and other places that serve high risk populations, or populations at high risk of foodborne illness. So compared to last fiscal year, we had completed 85 inspections that included re-inspections. And so we definitely were not on pace to give every establishment the appropriate amount of inspections, just based on our staffing. And now that we have increased staffing, we have now completed 126 food inspections through fiscal year 22. And so we're looking at meeting all of those inspection requirements, as well as completing the housing requirements as well, because housing is more emergent, so we have to deal with it as it comes up. But based on sharing between myself, Aaron, and Dan, who's been fantastic covering all the food in Wakefield, we've been able to cover all those in some. So our program has really expanded. I think we've really been able to work on inspections. They've come before the Board of Health with multiple establishments that just need a little bit of a reminder, some education, just to reinforce food safety principles. We've also had 22 food re-inspections, and so that kind of gets to the ability for us to follow up when there are issues. I think before we were kind of weighing the importance of having repeat violations and how often we have to go back, but now because we have the adequate staffing, we can go back and make sure all these are followed through with. So we are on pace to completing all 285 routine inspections that are standard, and also being able to cover all re-inspections that come up. Our environmental health kind of profile. So we've had 38% of our complaints are housing complaints. And so one of the things we wanted to kind of get at so far has been that housing complaints take up a lot of our time. Many of them require re-inspections. They're pretty time consuming. And I think one of the important things to highlight, and Catherine and Cindy did a great job kind of identifying, breaking down our housing complaint types. And so we had 70% of our housing complaints coming from buildings with 10 or more units. And so I think this is a discussion that Wakefield's, having constantly about new developments, more people coming in, so we have to kind of evaluate based on our capacity, as an inspectional services department, how do we keep up with this increased capacity, right? We want to make sure that we're serving all residents. So it's something to keep in mind. I think it's important to, to know that we also do housing, trash, dumpsters, so they're all tied together. Noise, odor, tobacco, smoking, and in smoke-free housing, all of those go together, including rodents. So all these different types of complaints do come together. And so it's important for us to be able to, identify when there's an increased need and address those as necessary. Trash complaints made up 10% of our complaints, and rodents were 10%. We're working with the regional groups, still a public health excellence grant. We're continuously looking at different literature, best practices on communication with residents, how to best enforce best practices, and also taking care of our municipal lots and our municipal buildings, but also working with residents to continue to limit rodents in their property. So permitting. In fiscal year 22, we received $44,000 in permitting. We're actually, one of the items tonight in the agenda will be to look at our permit fees. We'll be updating that fee schedule, hopefully with the board, just to more accurately reflect the amount of work that's put into these different types of permits and the inspections that are required to go with it. So one example would be, historically we've had camp fees at $10 a year, which is kind of disproportionate to the work that goes into permitting a camp each year with the multiple inspections a week, that sort of thing. So we're going to be proposing a change to $200 for the camp, for the individual camps. And there are about 8 different permit fees that we'll be looking at that'll approximately increase our revenues from permitting by $6,500 this year. So another topic we want to kind of touch upon, and I think it's important for finance committee, for the town council to kind of understand, is what we're seeing from community health trends. And so based on the most recent community health needs assessment, our top 3 causes of death in Wakefield are complications of dementia, heart disease, and lung cancer. And so we have implemented different programs just to tackle these different areas of health. And so we have substance use concerns. We've identified as one of the areas where we're above the Massachusetts state average. The SNAP gap, which has actually only increased since the last community health needs assessment in Wakefield. We're looking at increased higher than the state average cancer rates and social service needs. And so a lot of these are being addressed through our program with Jason. Having a social service coordinator has been very helpful, both from the fuel assistance program, but also connecting residents to existing resources. Some of them are very complex, especially housing. Housing forms are really difficult to fill out. It's very time consuming. The process is not straightforward. So having somebody have that expertise is really important to help people fill those out. We're also working on community education. We have great engagement with the COA. The Alzheimer's Association. We also have, in the next slide, we'll talk about our part-time public health nurse in Wakefield, who does a great job engaging with seniors. They hold a blood pressure screening there, I believe, every week or every 2 weeks, I believe. Just being able to do some education around healthy eating and healthy lifestyle. And we're also still continuing to work with Maureen Busby and the Youth Action Council, Youth Action team on tobacco prevention, smoking cessation. I think these are important programs that we're continuing to work on. So public health nursing, since we've added Sandra Brown to our team, she's part-time, 19 hours a week. She's been working with Melissa to be able to keep up with our demands with summer camp inspections, more of a seasonal issue, but with the review health forms, sometimes on a weekly basis when new campers come in, make sure that camps are safe for kids to attend. She also has been really helpful in reviewing camp policies and procedures. A lot of that goes towards education for counselors, camp counselors, and it's a little bit of a revolving door in terms of people who run these programs. So we want to make sure that every season they have the adequate training. She has been working very diligently on vaccinations this year, and we'll go over the nursing report. But this year we've had 37 flu clinics. That includes both office and homebound visits. Flu vaccines, we gave out 1,300 vaccines. COVID clinics may have decreased slightly this year in terms of participation, but that's still, every clinic is still very time consuming to put together. So Sandy and Melissa have been working together on that. And all the public health nursing pieces that still go into it, we have to keep up with communicable diseases. So they work with people in the community to make sure that they have the best practices. They work with Maven and work with the state EPIs to keep up with folks that may need follow-up, more information. And we also just continue our clinics, such as at the McCarthy Senior Center and other places as well. One of the major goals, because we now have increased capacity with the new half-time public health nurse, one of the goals is to increase health promotion, community education, and reaching underserved populations. And so Sandy has a great connection with with DMH at the state. And so we want to be able to reach populations that may not be able to come to our clinics normally. And we want to work with our school community as well. So we want to be able to work with our ESL and provide potentially vaccinations at these ESL nights, and be able to just expand our service in the community. So in terms of social services, Jason came on in September, and he's currently being funded by ARPA funds. To date, he's served 94 different households. And so just looking at some of the breakdown for the referral source, a lot of the referrals do come from our Wakefield food pantry. So that partnership that we kind of originally had in mind has worked out really well. He actually has an office down, as you guys know, in the Civic Center. So that kind of cross collaboration, we're catching a lot of people that may need additional resources outside of food, and so we've been able to provide that. A lot of this, all of the services that are access are food insecurity assistance. We talked about energy and fuel assistance. We've also had housing assistance, which is one of the big areas that we identify as a region that we need help in, and also substance use disorder services as well. So we have a variety of referral sources. I think we've done a good job of kind of marketing this position. We've gotten engagement from the town council, other community partners that will get the word out to people that may need help. And so we hope to continue kind of making his services more available, making people more aware of this as we go forward. And just a breakdown, we have a breakdown of the residents served. We have some demographics, but it's important to know that we have a diverse population that requires translation services, that requires different means of outreach. And so we want to continue to be mindful of that. We can see that Spanish, Brazilian, Portuguese, those are our kind of next major languages that are being most served outside of English speakers. And so we want to make sure, especially now with potentially more residents coming in speaking other languages, we want to make sure that we have a good idea of what those are, and so we can maximize their access to town resources. And I think a good thing to highlight here as well for the age, we have about 18% in the 61 to 70 age range and about 14% in the 71 to 80. I think it's important to highlight that Jason works very closely with our Council on Aging. We have a great social worker at the Council on Aging, Beth Greenberg, and Karen's been doing a great job working with seniors, but I think there's always a little bit of overlap in that work, and so we're able to provide a lot of different resources in that way. So we thought it might be a good idea if we kind of describe kind of a couple of case studies on, how folks get to us sometimes, and really, what we end up connecting them to. I think it's important because we talk a lot about, food insecurity. We talk a lot about kind of generalities of housing and kind of, the referral source. But I think it's more concrete if we're able to discuss kind of like, where people are coming from and how and what sorts of resources they're connected to. So our first case here is a male in their 30s. Originally, they came in looking for assistance with Mass Health application. So we were able to connect their spouse to Mass Hire after speaking with them. So Jason was able to work with them on that. We were able to assist with successful SNAP. I now realize it's a little bit small, so we should probably zoom in if I want to make this a little bigger in the actual presentation.
Yeah, when you actually do the presentation, put it on slideshow so you don't have this left bar going on, and you'll be able to see. You'll just be utilizing more of it.
Yes.
I believe that's it. Catherine would be the expert. Much better. Thank you.
There we go. Actually, the Zoom faces are blocking me, so I can't see it. But okay, so we were able to assist with successful SNAP benefit application. They have been enrolled with food pantry. Now they receive DTA benefits, winter clothing for children, and immigration support. And so this is a good example of, came to us with one need, one known need of assistance with Mass Health application, but then was able to leave with, with all these different resources to be connected to that may not have known about before. And the referral source was from Wakefield Public Schools, which is a great connection that we have with the schools. I think it's important that they are able to refer people to us so that they're not, swamped with helping them reach these resources. Another example is a female in their 60s. They came and they were looking for SNAP benefits. They had questions about that, and we're able to connect them to a lot of other resources: Medicare prescription benefits coverage, DTA, transportation, heating assistance. So another referral source that came from the Wakefield Food Pantry, which is a good example of our cross collaboration there. all of which these applications take quite a bit of time to fill out. So Jason was able to help them answer a lot of questions and connect them to those. And our last case study was the referral sources from St. Joseph's Church. They came to us looking for help with heat. They had a broken furnace. And so we were able to connect them with heating assistance and a new furnace through multiple different funding sources. That includes the Wakefield Emergency Fund, I believe. But that also, we're able to help secure rental income, behavioral health support. We connected them with Mystic Valley Elder Services, which is a great resource in our community as well, and also Meals on Wheels. And so I think this is these three examples are kind of great case studies in the sense that sometimes it's a simple referral that's required for folks to get to what they need. But sometimes when we're able to sit down with them and kind of figure out what their needs are, sometimes other things come up, and so we're able to kind of be like a one-stop shop for them to reach its resources. We also have, we talked about this a little bit earlier, but we'll definitely have this in the presentation to FinCom and to Town Council. The new Field Assistance Program, it was approved by Wakefield Town Council, so they'll know about it. But it was a great cross collaboration between our department and emergency management, IT, accounting, just to build this program out from a back-end standpoint of software, but also make it more user-friendly. We were able to work with 15 different heating oil delivery companies, and we're able to process $750 payments for residents. We continue to have a great relationship with Wakefield Gas and Light, that's able to, if their customers need help filling out forms or if they have questions, Jason's able to kind of field those questions and help them answer it or connect them back to Wakefield Gas and Light. So the program itself has been very successful, and we hope to continue the service. So in terms of behavioral health and substance use, we're working through the final year of the DFC grant that we've had for 10 years. Lots of great programs have happened during these 10 years, but we've learned a lot, and I think there's so much that we want to carry forward, and so we're looking at different funding sources to continue these great programs that have benefited Wakefield for a long time. We obviously work very closely with police, schools, with Elliott Services, the BB Library, Melrose Wakefield, all these great partners we've worked very closely with to address a lot of the behavioral health and substance use issues that continue to happen and have been exacerbated post-pandemic. Things like Wakefield Parent University, senior night at the high school. We also have programs on marijuana and impaired driving, ESL family night. All of these great programs through the coalition have been sustained for a long time, and now we're looking to see how we can continue those forward after DFC ends. And so one of the things that began last year in terms of the transition, so Catherine was moved salary-wise from fully funded by the DFC grant, and now half funded by DFC grant as we move towards the end of the year, and half funded by ARPA. And so her role has definitely expanded. We're working on kind of public health and wellness programming and staff, especially with more staff coming in. She's been able to help kind of steer the social service coordinator position and the DFC coordinator position as well. She's also has been directing the Wakefield Unified Prevention Coalition, Wake Up, and also has helped manage the new positions as well. There's also continuing to coordinate collaborations with different departments. As different grants come in, as different issues arise, we're able to partner well with other departments. The continued grant writing and reporting is an important piece of this as well to make our departments functions sustainable moving forward. We've as part of this presentation, as well as the newsletter, the evaluation and analysis of metrics for the health department are important. I think we talk a lot about programs we're working on, staff, and great things we're doing, but we want to make sure that we're still reviewing what we're working on, making sure that it's still effective, and how we can possibly streamline some things we're doing to make it better for Wakefield. We also develop new department programs, and she continues to be the Wakefield Youth Council and advisor. So a lot of this is really important, and obviously the town has shown that there's a commitment to health and human services expansion. So we're looking to have a transition into a more sustainable funding source, and so we're looking to move this position into town budget soon. And just to wrap it up, some additional grant initiatives and programs that we're working on. We're actually going to be hosting a camp with recreation. And actually, is Catherine still here? I can't see the. Oh, Catherine's still here. Did you want to touch on the summer camp that we're going to be doing?
Yeah, it's just a new initiative that Recreation approached us with. Dan had done it in Arlington, and he said, oh, we partnered with our health department and our police department to run a camp. So it's a week-long camp, and Amy and the youth action team will be facilitating workshops on everything from sun safety and healthy eating and physical activity, and with the somewhat older kids, things like substance use. But that's the camp. So Rec is really managing the registration and everything, but reached out to us about partnering, and we said sure.
Yeah, so we're continuing to work with the Alzheimer's Association, Melrose Wakefield, National Fitness Campaign. We had that park put into Moulton Park, the fitness court, which was great. We also have the Wakefield Alliance Against Violence, of which Amy is very much a big part of now too. And we continue to work on our environmental health and prevention. That includes sewage backups and lake queue, animal control related questions, floods. So and mosquitoes. And so we're working on a lot of different programs that maybe traditionally are more health department related functions, but as you can see, we've definitely expanded into more areas now with more capacity. And yep, that's it.
Nicely done.
Yeah, that's serious.
So
Lots
Andy,
of things.
do you have the like dry version of the actual budget that we need to present?
I do, yes.
Not that I want to see it, but we always have.
I was gonna go over the budget probably after this presentation. We're taking things out of order. We're taking things out of order right now. But
I can't see three things. I can't like look at my agenda, and I already have two computers open.
well, we'll get you a third.
So you do whatever you want. I know.
Okay.
You have an iPad.
Oh gosh. Yeah. So we'll definitely go over the budget after this. But yeah, just first pass. Did you guys have any? I mean, there's a lot of stuff, but was there anything that you wanted to see changed, added, further elaborated on?
Very good. Very, very good.
It was really comprehensive. I think I like that you took some time to highlight what the biggest line items in last year's budget have sort of like what we did with that. And I think that's going to be important. I mean, we all know how great it is, but I think it's important to kind of show that. And you did in your presentation, like all the wonderful things that we've done with those resources. I think it'll probably make the folks that are listening feel good too, because we did have good support for the budget. So I think folks will probably feel like, oh yeah, that was a good idea that we approved that. Okay.
Part of me too, just, after years of going through this process, like one would be, and this is what we didn't do 10 years ago. Like, even just the amount, like, so 15 years ago, the inspection rate, like the answer, the question was, how many inspections can you do? And the answer was as many as I'm able to, like there was no solid data. And just, the evolution is breathtaking. And some people on finance committee have actually been around that long and they'll recognize that. But, not that we need to belabor it, but I just think it's kind of fun to go, wow, so before we had the CADCA grant, we really were kind of inspectional services only with a little bit of tobacco. And, I don't know that our bottom line to the town, I mean, I know it's definitely starting to reflect a little bit more of the actual work we do, but like we're still kind of a blip in the town budget. And I would say that we're biggest bang for the town tax buck. I would say. I might be biased.
I would
I
agree
think
with
talking
you.
about inspection too, that's something that many people can relate to. Like people go into stores and restaurants and stuff like that. Maybe not everybody is involved in the school system that's listening to this presentation, but everybody's probably buying food in town. So when we talk about how we're able to really care for the folks that work in those industries and like make sure that they're as sanitary as possible, I think it resonates. Do we want to talk about like any of the regular stuff we're still doing? Like, I don't know, chickens and like all the sort of not glamorous new cool stuff? Is it, I mean, I wouldn't want you to like have a big presentation that people are gonna sort of like not be able to fully stay focused on, but we're still doing all that other stuff too. It's not quite as maybe like newsworthy, but all that stuff is still happening. Like we're still preparing for our vaccine initiative for next year. So
Yep. Oh, absolutely. I think, yeah, kind of getting back down to statutory requirements. We still have clinics we prepare for. I think we had. I think maybe we can do a better job of highlighting that in the public health nurse slide. But yeah.
Yeah, I mean, I think that is small. If you zoomed out and saw the number of clinics and all the work that goes into that, so maybe there's a way we could edit that somehow. And then Cindy's chart on all the permits, I think maybe I can make that bigger or figure out a way so then they can see in the presentation like animal permits and all that stuff. And maybe Anthony, you can add in some talking notes on like what goes into giving an animal, a chicken permit or the tanning or the everything you're talking about tonight with the body work, body art and things like that. So maybe that's something that we can play with.
I mean, there's like almost 1,000 permits we give out every year.
that's a huge
Yeah.
amount of time. It is a source of revenue for the town also, which I think if we're talking about money, that's money. So we should bring it up.
I don't think that people realize just because you get a permit, like a dumpster permit, how many times do we get complaints and we've got to stop, we've got to send an inspector out, or somebody calls because the guy down the street has 25 chickens instead of 6 chickens, and little things like that. And just going into, I used to find just saying to people, and I think we did this a lot when we did our pricing, is going into a supermarket for a food inspector to go in and do an inspection in a supermarket. It takes a lot of time versus
It's at least 3 hours. Yeah.
Oh yeah, it's not easy. Even a restaurant and the tiny little convenience store, what you have to put into it, and tobacco permits, and just keeping track of them, Cindy. I've been there, done that. It is not easy. And I don't think that people realize how many and why you have to get a permit. That's what really is something I find people, because I've had people say to me, well, why do I need a permit for a dumpster? Why would I need the permit for that? And then you explain it to them and then they go, oh, I never thought of that. I think that's something too, that people just don't realize the amount of work put in.
Is it worth it to mention, or maybe not worth it, how we sort of were advocates for the folks that lived in that apartment building, that we sort of, Erin was involved a little bit more in like advocating for the sanitation stuff.
Audubon.
Yeah, exactly. And of course, like doing all what we're doing here, like we recognize that those folks are Wakefield residents and we were a voice for them. When maybe
it's a good idea. It's a good idea to highlight that. And I think maybe, so the third slide where it's included, it says housing's 38%, but 70% of those were in
For
buildings
instance.
of 20 more units.
Yeah.
You're absolutely right, because I think those we need to bring more attention to. Those residents that live in larger settings. Those take a lot of time, right? And so if you think about it, all the new construction and all that, more people are coming in, so that there's going to be more inspections required. So the fact that they make up a bulk of our housing already is pretty telling.
I mean, and then keep in mind with when we have those figures, like the 143 complaints, that's the initial complaint. That doesn't show every time
follow-ups.
one complaint, we could have gone back 4 or 5 times.
The
So,
same thing
with
with
the-
inspections too.
Yep.
so that number is really not completely accurate of the time. But that we have to, the OpenGov system that we're using wasn't made for this complaint, but we've kind of made our own. So we have to work on figuring out how to keep getting those numbers to recognize our re-inspections on that.
Yeah, because I think Aaron and Cindy were trying to figure out how many of those were extreme high levels, because you have some that the board's familiar with that were leading our department to do 30-40 hours worth of work on one of those complaints because of everything that came out of it.
Yes.
I mean, bottom line, you don't want the meeting to go on forever. So you just have to, cherry pick the highlights. Going,
Right.
you guys know what you do, we do, that we're, I mean, I think it's hard to embrace a cogent presentation. So I think that presentation that you put together, Catherine, looks pretty fancy. Just keep it as big as possible, because it's all sorts of tricks when you're presenting.
We'll get
so
lost
good
in the
luck.
weeds if it's too many details. People start asking lots more questions, and then we lose sight of the sight of the actual.
So bottom
actual
line,
information.
we have grown, but we're efficient and we are mighty.
I'll save that as our motto.
No, it's the 3 Ps. Prevention, promotion. What's the other one? Prepare. What's the 3rd P? So tired. Okay.
All right, that sounds good. So if there's no other questions, I mean, obviously we have plenty of time between now and the presentation. So anything you guys think of, just let us know. We'll make a change to it. Yeah.
Thank you guys for all the work on it. It looks good.
Very good, very, very good.
Yeah, thank you to everybody who helped put it together. I mean, everybody pulled their stats, and Catherine was the one to wrap it all together into like a cohesive format. So.
Next.
All right.
Yeah.
So should we?
Budget? Do you want to talk about the budget? Does that go with this, or did you want to show the budget, or
Can
are
we maybe
we over
should
that
do?
tonight?
Yeah, we can do budget. But can we do permit fee comparison first, and then we go into the budget? So I'll share my screen here for the permit fee. Do you guys have that? You guys have that document, right?
Yep.
The Excel sheet.
Yes, Excel sheet
Yeah.
for
Yep,
permit
yep.
fees. Yeah.
Yep.
All right, but I'll just share it anyways, so you guys can see it. But yeah, okay. So we can start with animals. And so we sat down with all 3 communities, Cindy, Denise, and the 2 admins in Stoneham. Were able to kind of compare notes, kind of see where each community falls, because we want to be relatively in line with the region in terms of fees. We don't have to be exact, but it's good to be close. So we can see that there's a couple of things right now. Wakefield for animals. We recently went over that because we went over the animal regulations. So no changes as far as Cindy. There's no changes as far as animals, right?
No.
Okay.
No.
Yeah. So no changes on animals. Other communities, we propose that they kind of match ours for the most part. So I think we didn't have a stable fee, but I don't think we have a stable in Wakefield. So
Right. Yeah.
if it ever comes to it, we can figure it out. But yeah, we don't have a stable right now.
On land.
Yes. So right here, so right here, we're looking at body art and body work. Currently, I believe we're at 500. We're at 500 for the initial body art application. That's like the initial new application. The plan review, it's extensive. There's lots of moving parts, and also the initial inspection is pretty hefty. So we're currently at 500. We did talk about proposing a change. So if it's a minor change, so if it's a change in ownership for a body work or body art institution, and there's not a lot of things that have changed, then we might just charge them a lower fee for minor renovations, and we keep major renovations at 500. And this is more of a discussion on fees today, and then if we want to change any of this, we'll vote on it next week or our next meeting. So right here we already have that body art apprentice. So per apprentice right now we don't have a fee. We're proposing, because we actually looked into it, and Stoneham actually was charging $25 per apprentice that was taken on. We're just proposing to do the same for per apprentice. We're looking to charge $25 per application. Body work, same thing. Right now, we currently it is 500. We're proposing same thing as body art, minor changes and renovations. We're looking at 250, and major changes we'll keep it at 500. That's the proposed amount. Bodywork establishment per year, we're currently at 150 for renewals per establishment. We're looking to increase that to 200 to bring it into line with Stoneham, and we're going to be doing that in Melrose as well. So we want to bring that in line with that. And then bodywork, each practitioner is required to submit a license as well, or file for a permit as well. Currently, we're charging $75. We're proposing to increase that to $100 to bring that in line with the rest of the region. Do we kind of want to do section by section? Do you guys want to kind of go over and check off or discuss as we go?
Just keep going the way you're going. It sounds fine. Most of the stuff doesn't seem really like it's changing dramatically, right?
No,
Well, nothing's changing too much. Right here, it looks like we're increasing by 50 here for
But
bodywork
it's in line with what
establishment.
the other towns are doing, right?
But it's in line with the other towns.
Well, wait a minute, it's not. You're proposing these increases across the board. So who's the first column? So Melrose is
Yes.
150. But you're proposing to go up. So the 200
Correct.
is a proposal across the board. You
Across
know,
the board, yeah.
I just want to pause for a second in regards to, you know, people are getting hit from every direction. So you know, in regards to increased pricing. So I would like to say something a little bit, I would feel better if I had a better answer than we just want to be the same as the other communities. I do believe we do as a tri-town sort of thing. We need some consistency, but this is a case where 150 is the standard right now, and we could keep it there. I would like at times to see if there are places where we could not go up, just even for the appearance that we're not trying to jump everything. I mean, unless there's a disproportionate cost. I mean, permits have never really reflected how much the work is, because we have our baseline department doing the work. I don't know. I'm just a little feeling, you know, a little cost increase fatigue on behalf of the world.
I think you're right about, you know, we're not trying to be punitive with the fees. I think, you know, we're right. There's some level of still economic recovery going on right now. I think it was definitely a tough couple of years, and everything's going up in price. I think for us, the rationale, you know, besides being consistent across the region, I think one of the things we compared it to for body work at least was body art. So body art was already at 200.
Yep.
For per establishment and practitioner was 100. And we were looking at body work, and as you guys know, these inspections are pretty extensive. There's a lot that goes into it, lots of re-inspections. So we just wanted to bring it in line here, at least with body art, where kind of similar scope of work,
Okay.
similar amount of time brought in. But you're absolutely right. I think
I would rather hear it that, you know, I just think it's important that anytime you're presenting this kind of stuff, that it's not just to match all the other communities, that,
Right.
you know, that we have a valid reason, because we just really, everybody's getting hit.
Yep, no, that's a good point. And I think, yeah, we can I can do a better job of kind of explaining that, here at least, this is an example of trying to bring it into a similar fee schedule as a similar practice, in the sense that, similar times for
Will work.
inspections.
Yep,
and
okay,
follow-up.
I
So,
gotcha.
Well, and Laurel, just as if I can interrupt, I did a comparison with Winchester and Medford,
Yep.
and our
Right, much
fees
higher.
are lower.
Okay,
And these are just comparing because we want to stay in line with Stoneham and Melrose, because that's our
right,
group, but that's why we're showing you this.
okay, so
But-
that's, and that's helpful to know as well, I mean, we've done that, we've looked across the region. But again, we just
Yep.
showed the social services slide that, talks about the proportion of people who actually qualify for help. And so we're not Winchester, but, go on, just,
Yeah.
as I
Mhm.
said.
These
Well,
services also like, at least this group of services, these are, somewhat luxury services.
Right, yeah,
Also,
true,
so,
true,
I mean,
Yep. I agree.
Okay, yeah, but the good thing to keep in mind for us is also the way we present about it, right? You're
Mhm.
absolutely right about that. So, okay, so hearing no objections, do we have any objections to the body art, body work
Nope.
piece? Okay, so we'll move on from there. Funeral director, burial permits. This did not change for us. Well, because we don't do burial permits in Wakefield. City clerk does, the town clerk does that. The funeral director, I don't think we changed that, Cindy.
No.
No.
That's amazing to me. Why is that so low? Because we don't actually inspect them?
No, we don't.
Oh, we just look them over, but you still have to catch their license. I mean, I've
Yes.
always seen it at least 100.
I was gonna say, that seems incredibly low to
We
me.
only have really one.
We have one.
One.
We have
that's it
one,
in the
one,
town.
we have one funeral home, but 6 directors.
Directors, yeah.
Oh, it's per
Yes, that's
director, never
Yeah,
mind,
it's per
Okay.
person, yeah.
gotcha.
Yep.
Okay,
Okay, so yeah, here I don't think there were any.
being that
changes
I'm
on my
closer
side.
to being a customer, I guess.
Oh, that's because it's just got really grim. All right.
I
Hey,
have
we're
them in
nurses,
the
buddy.
family. Yeah,
It's gotta happen. Like,
I have all funeral directors in the family, so I know how they complain about the fees every year.
Oh gosh. Okay.
Move along.
Hearing no objections to the death section of our conversation. Okay. Okay. Disposal. Okay. So we're currently septic plan review. Cindy, remind me, do we have a current? We don't have a current fee for septic plan review. Is that right?
That's correct. That
Yeah,
this
so-
this would be, I've never done one in Wakefield. So this would be
Right.
something that's on here in case we ever have to come do a septic plan review.
Just from experience, because we do have a few septic systems in Melrose, not a lot, but we have a couple, and Stoneham has a few as well. Those plan reviews are very extensive. There's a lot of back and forth, different systems, and they're all a little bit different. So I mean, when we do get them, they're time consuming. So I think just looking at, it's not listed here, but some of the other communities in the area, how much they charge for septic plan reviews, this 150 seemed reasonable to us. Stoneham had a $50 charge originally, but I think they hadn't updated for like 12 years, 14 years, I
Mhm.
believe. So we kind of discussed, and it looked like this was a reasonable amount for us, at least, just compared to the region.
So, because I'm doing this project elsewhere, it seems to me like so the plan review I get, but aren't private contractors doing the septic perk and the septic soil, or is that a redundant test that we do
Well,
to
it's
make
the
sure
sep-
that they're on?
Right. The septic perk, we still have to go out and witness.
Okay,
And then they are conducted, the septic perk is conducted by the private contractor,
Okay.
but we have to witness it.
gotcha.
The
Okay.
plan review, the plan review is still done in-house. A lot of the soil evaluation, the private contractor will also do, but we have to review all of that.
Okay, gotcha.
So that's separate from the plan review. So
Right.
so these are a little bit lower than the plan reviews. These aren't as extensive, but the way we calculate this, I'll move on from plan review to soil evaluation. So this is based on kind of like a private contractor rate. If we were to hire somebody to do
Right.
a septic soil evaluation,
That's right.
it's roughly $50 an hour. It usually
Yep.
takes an hour. Even if it goes a little bit over, it averages out to be an hour for these. So both the soil evaluation and the perk test, we thought $50 was, reasonable based on the going rate right now in the market. But
Well,
again,
the cost of the systems are, over 40K, so. Makes sense.
so so the plan review, soil evaluation, and perk test, these were based on kind of the hourly rate that we thought that generally are required for this. Disposal for septic construction. Currently, we charge 50, but we decided to remove this. I think we're going to remove this permit, and we're going to combine it with the disposal works installer. Just because those two are hand in hand. We'll be doing that same thing in Stoneham. Did we not have this in Melrose? Maybe we didn't have one before.
Oh,
We might not have one before, so we're just combining it. So we're currently at 50. We're looking just to propose 150, and this usually takes 2 to 3 hours for us to conduct with them as well. So we're at 150 now for disposal works installer.
again,
Something-
we've never, we've had it on our schedule, but we've never had to use it.
Right.
So now it's there in case come
Yep.
across it.
Disposal works installer. Did we just go over that? We just went over that. Septic abandonment. That's what I was gonna say. Septic abandonment, $50. I don't think that changes for us, but we did use that as kind of reference point for the other communities. Usually takes about an hour for a septic abandonment. Transporter for garbage.
Mhm.
So trash hauler, I think we kept it at 150. The next change we made was dumpster permits. It's a long term for dumpster permits. Currently 50, we're proposing $100 for that. Both bringing in line with the region, but also we've had a bit of an uptick in terms of complaints for dumpsters. So it's quite a bit of time for us to kind of go out to each complaint, figure out who owns a dumpster, that sort of thing. So as part of all that, as part of all that work that goes into it, I think we just wanted to increase that. And I think that's been the same for a long time. I think dumpster permit fees have been the same, but we're just looking to update that. And then dumpster permits for short term, we believe we did $40 for 45 days. And we do, if they don't want to do an extension past the 45 days, another 45 days, it'll be $15 additional for that.
We do $40 for 90 days. And
Right.
so what we're adding would be the 15 to extend it to another 45 days.
And this actually might
How
even
many
get.
times can you extend it though? Do we have a limit on how many times? Because I've seen it where they get one for so many days and then they they come back again. And then if they had gotten a yearly one, they would have been better off. You know what I mean? If they run into problems.
Yeah, it's a good point. We could look into putting like a limit, like maybe 2 or 3 extensions or something, or maybe 3
Yes.
extensions. I think the good thing for us is if we cut it down to 45 days and then require an extension, it gives us a better grasp of short-term dumpsters because we're not constant. We don't have the time to constantly survey for them, right? But if we kind of put that stipulation in there and have them come back a little bit more often, it keeps us kind of closer managing those short-term dumpsters.
Mhm.
Yep. Okay. So before I move on, did everything in disposal make sense? Were there any questions? Anything we should consider? Okay.
Good.
All right. So for food, we made a couple of changes. The plan review, all these stay the same. Up the residential kitchen, food service for 0 to 50 seats. We did increase by 50. This was also just kind of a reflection of some of the increased time we've spent with these establishments. I think we've gone back for multiple re-inspections now. And part of that is kind of like a post-COVID kind of recovery still for them. I mean, it's been, you know, about a year now, but they still require a little bit more attention, a little bit more kind of like retraining of some of the good habits that they had before. So we're just proposing a slight increase of that just because of the amount of re-inspections we're performing right now. Same thing with 51 to 100 seats, and the food service for more than 100 seats, so they're generally pretty time consuming as well. So we just across the board we increased by 50, but that's due to the increased amount of re-inspections we've been conducting. Food service and establishment plus catering. So that's the establishments that also do catering. We're proposing a $25 additional establishment, which actually, you know what, we're already doing that. We already have the $25 additional. Food services are catering only. We're proposing an increase, and it's the same rationale for us. Some of these catering, we've had more catering businesses enter Wakefield as well. But also similarly, just post-COVID, we want to make sure that, you know, the increase in work that we're providing, services we're providing to these places, we're also matching that with our permit fees. Frozen dessert, we're proposing a $10 increase to frozen dessert, similar rationale to the other food services. Incidentals, food service, nonprofit, we kept the same. Temporary event. So we have the stipulation is still the same, 14 days before an event, or we'll be adding a $100 late fee. This is more for capacity reasons. We've had some run-ins in the past where people have tried to add things last minute. We just don't have the capacity to inspect those. So we make it pretty clear to everybody that 14 days is the 2 weeks before cutoff for temporary events. Those can be plan reviews and everything that take a lot of time. And I think we're proposing a $5 increase to that. Food services, seasonal mobile truck, we're proposing $150. I'm not sure if Cindy's still there, but I don't know. I don't remember exactly how much we were charging before for the seasonal. Cindy, do you remember how much we were charging for mobile food?
I'm here. 100.
We were doing 100. Okay, so originally we are doing 100. I think we're increasing it to 150. We don't have a lot of mobile food in Wakefield, but we know a few, and it's the same thing. Just a little increase in capacity for us. Food services, mobile ice cream truck. Currently, I think we charge $75, $25 for every additional unit. We're proposing $150. Historically, we've had some challenging ice cream trucks in Wakefield. Definitely a #1 public health priority for us. But I think just the amount of time we've spent chasing people down to get permits and to be, you know, to have the appropriate documentation for their food, for their ice cream truck, it's been difficult. So, you know, we're looking to kind of at least be proportional in terms of the amount of time we spend and the amount we're asking for. Farmers market. So this one was an interesting one. I think farmers market for seasonal, we are proposing an increase to $25. Originally, we weren't charging for it. I think Stoneham historically was charging $25, but I think part of it, and we could have a discussion about this as well. I think the farmers market, it's, you know, when it's around, it's weekly. There's a lot of time spent on this, and there's also weekends, right? So weekend hours for inspectors to go to make sure they're compliant. We've had a couple issues in the past. Vendors generally are really good about correcting those, but you know, farmers market generally there's a lot of change. New vendors come in kind of last minute. You know, we can't always mitigate those as they come in, but so we were proposing a $25 per vendor charge. The farmers market does pretty well, and we want to make sure that we're compensating for the amount of weekend hours spent by our inspectors to do this. So were there any reservations or anything by anybody about this increase?
I agree.
Okay, that sounds good. Let's see, food service, and then we also have retail food. 0 to 9,000 square feet. We're proposing a $50 increase to all levels of retail food based on square footage. Same rationale to the rest of the food service section before, just an increased amount of time spent on re-inspection. So we're looking for a $50 increase for all of these.
The big one is more than $50.
Oh, I'm sorry. Yes, you're absolutely right. 0 to 9,000, 9,000, 30,000 is 50. So 30,000 square feet and more, we're proposing 350 to 500. This, and correct me if I'm wrong, Cindy, I think we don't, do we have a 30,000 and above?
We might have just Walgreens or CVS. That might be the one or two. I think they're the big one.
Or
Or
farmers.
Shaw's.
Oh, Shaw's, yes, Shaw's, you're right.
Yeah.
Yeah, Shaw's is probably our only major retail food.
Yes,
And Shaw's, as we discussed before, I mean, supermarkets can
It's been
take,
a lot of our time. Yeah.
yeah, it's like 3 to 4 hours for a grocery store to do it well. We generally send more than one inspector to a grocery store because it's pretty hard to manage as one inspector. So we're looking to bring this in line, and actually places like Stoneham actually have more experience with these large establishments. They have multiple grocery stores. They also have BJ's. So they kind of looked at their time spent on these large establishments. The same with us in Shaw's and Melrose. We have Shaw's and Whole Foods. So you know, we're looking to increase more for 30,000 square feet and more. And I believe, okay, and then the last one's retail food incidentals. I think we're just going to remove that fee. I don't believe we have any in Wakefield.
What does that mean?
The incidentals, did we determine what that was, Cindy?
It's like a gas station that has candy, just candy.
Yeah, I think it was things that didn't qualify as a risk one, I think, because it was just like, I mean, there's some prepackaged stuff, but just, you know, a establishment with a very, very low risk.
So it's low risk, but I wonder if, like, do they still have to get, I don't know. I wonder if it kind of makes them pay attention to, we are this, because, you know, some of our, like, a gas station that also sells hot dogs goes into a different.
Oh yeah, absolutely.
Right?
It goes into risk 2, I believe. Yeah, risk
Yeah.
2.
So I mean, I just want
But
to
think about your gas stations. I think, Laura, you brought up a really good point about your gas station that sells maybe just candy, Anthony, but also at the same time, you would see them have bags of chips, little tiny like mini drakes, you know, little cupcakes and stuff. And they sometimes tend to not pay attention to expiration dates.
Well, okay, so that's like, you're absolutely right about that. I think the tricky part is expiration dates are not enforceable FDA code.
But
Um,
are your retail food incidental also gas stations that sell dairy products, milk?
No, I
so
think that goes to a
they
different risk.
That
if
goes,
they
right?
sell
Yep.
milk, and so I think when we were thinking about this originally, we don't really have great examples of retail
I
food
think our
incidental.
example is a hardware store, because they had like a couple of things.
Right.
Like
Oh,
they
the
had
cool
honey,
apples? Yep. Mhm.
like at Ace, they had like a few things. I don't know
Yeah.
about getting rid of it, but you know, it looks good to
This-
say that we got rid of something. If it's a pain in the neck to have it, I trust your judgment, whatever you want.
I actually think this isn't necessarily a pain in the neck. Is that Tito? Oh, that's cute.
Good idea.
No, but retail food incidental is not particularly arduous for us. I think we were looking to clean up the permit fee schedule. We're kind of taking out things that may not be.
Okay.
We're looking to take out things that may not be as relevant. We just don't have a lot. And you're right. Actually, I didn't even think of the hardware store. I mean, they may sell a couple
Do you
of things.
have
that
any of these permits currently on file?
No,
we do not
Oh.
know.
And do you know when the last time you did was?
I'm gonna say it was Wakefield Gas, like years ago. He had a $25 permit for incidental. And then I think the food code changed that,
Yeah.
you know, and maybe
Right.
even it maybe even North Shore Pool and Spa just had the popcorn.
Popcorn, right?
Right.
Yeah.
Remember
They
they did-
still
Oh,
do.
God.
They
Oh.
do,
Yeah,
they
and-
do.
And so he paid the $25 for the incidental, and then again, the food code may have changed it, it wasn't required.
So I think best practices, and I think there's gonna be an updated food code sooner rather than later, I believe. But right now there's a push kind of towards like risk ones even.
Yeah.
If it's even worth inspecting risk ones. I mean, they're
Gotcha.
generally all prepackaged. So, where it doesn't hurt to keep it. There's a scenario where this could happen.
I think it kind of looks good to say, look, we got rid of a couple.
Right.
It's a nice balance. It's like,
Yes, it is.
we didn't do
It's really
everything.
like, I don't know, the last like 5-7 years, we haven't had any. I don't know. I think we
So
can get rid of it.
So you think
I
it's worth?
think
Okay.
because you got to think about gas stations now are usually associated with a store that sells something, or
Yeah.
a pizza or something like that attached.
It's
Yeah.
true. And they'll have that next level.
Yeah,
of
there's not that
permit.
little tiny little place anymore,
Right.
that just sells gas or gum.
All right, on to housing. Good job.
Yeah.
All
let's
right,
get
so
rid of
we'll-
it.
Alrighty, we don't care about the bakery or the function. Just
We'll
go.
get rid of it. All right, sounds good.
Innovate.
We're moving on. Housing voucher inspections. So this is actually a bigger one for us.
Yeah.
So as more units come in, the state does not have the capacity to send inspectors, so they ask us locally to take that on.
Yep.
So instead of being in-kind services, because that takes a lot of our time, I'm proposing an increase to $75, or we're proposing an increase of $75 for the voucher inspections. So that's Section 8, that's other places. We've just seen an increased volume of that this year, and especially with more multi-unit housing coming in, we're expecting a pretty steep increase. So we're increasing it to 75 to kind of match what we're working on right now. And actually, it looks like Stoneham and Melrose were already at 75 before. So we're just looking to kind of be in line, but also the increased volume as well of voucher inspections. And then the other one is, and actually, oh, you know what? We already have this on the books. Cindy, $25 is already on the books. Is that right?
No, I never had that. The only one we started to do was the $75. That's wrong. We charge $75 for a pre-rental voucher inspection. That's the newest one we had.
Right,
We've
right,
only
right.
done one or two, and the other 25, I'm not sure what that is
It was reinspection.
because
So
it's
this is the-
new. What?
This is the
Whatever-
re-inspection.
Oh, re-inspection to that, correct.
Yeah.
Okay.
Yeah, so we've had to go back and re-inspect. Some of these don't meet all the housing code requirements. So then the re-inspections we're looking to be $25 for those.
Yeah.
Yeah. Okay. So, actually, so that's pretty much it for housing. For housing, yep. Were there any questions about either of these voucher
Mm-mm.
amounts? Okay.
So Anthony, you're only doing a housing for Section 8, or are you doing it for the ordinary person who owns a two-family, say?
So
Do
that
we
was
have
the,
that?
that
We
was a
don't have a rental
discussion.
thing, right? Yeah.
No, so we have had a discussion, and a few other communities do. I know Peabody does it, Revere does it. And it's something that we've considered, making it a requirement for pre-occupancy inspections. I think we've had a couple scenarios in the past where we've had some occupants that are not exactly, in good faith, working with the landlord. So it's a program that could actually help protect some of our landlords as well.
Yep.
And actually
Yeah.
increase the standard of housing for those in Wakefield as well, right? Because we're holding them all to the same standard. So this could increase the quality of housing in Wakefield, which would help our occupants as well as our landlords to protect those that are operating in good faith, have facilities that are intact in the beginning and then may not be after occupancy. So I think it's a program that we want to work on and we'd love to move towards, but obviously, as you guys know, capacity is going to be an issue, right? If we're looking at a policy of like anything over 2 families and rentals, we're going to require a pre-occupancy. It's going to be a huge lift for us to do. The other portion of this is we have to work with building department and fire on this to even keep track of all these changes. So I think it's a bigger discussion to have as a town, and I think it'll be a good source, because I think whatever revenue we generate from this pre-occupancy, we can actually then put back into the community in terms of maybe there's an issue with rodent control in a specific area that we can then put that money towards extermination services for that, right? Or, things that we can't do right now. But I think it'll help protect landlords, help increase the standard of living in Wakefield, but also help address some of those community programs that we'd like to work on, like rodent control and that sort of thing. So it's a bigger discussion, but I think we have to, at least with the capacity we have to do right now, we have to do these pre-occupancies when asked. So I think we should increase it to 75. Okay, that sounds good. Were there any other questions about the voucher and the housing?
No.
Okay. Late fee for any annual permit. We didn't change that though, right? It's still 50.
Sounds
Okay.
right.
For lodging, that hasn't changed as well. Recreational camp. This one
Changing.
we
already
did
talked
talk.
about that.
Yep, currently 10, going to 200. A little bit long overdue. Swimming pools were, so this one, it's an increase. It's quite a bit of increase, a 75 increase, but the reason we're doing that is because we've had quite a few, many pools actually not pass on the first inspection, and then consistently over the course of that not be able to keep up. And I think part of that issue goes towards finding adequate CPOs
Yep.
to man these pools. I think it's just difficult for them as well, but for the safety of those that use the pool, I think we still have to keep going out for reinspection after reinspection. So these take a lot of time seasonally. So we're looking to increase that to 150. Indoor pool stays the same. I don't think we have any waiting pools, so I don't think we have any in there. But any questions about swimming pools?
Nope.
All right. Tanning has not changed, I believe. Tobacco's kind of its own separate thing. If we're looking at changing fee, and we have been following state regulations, and so that's more of a separate discussion, but that's separate. And then wells, I think we already were at 100, so that's it. We've made it to the bottom.
Hold on. Yeah.
Thank you for sitting through those riveting
Oh,
parts.
it's dry. Well done.
All right. So if we're all good, what we'll do is we'll bring this back to the board next meeting, and we'll just do a vote on changing these permit fees. We'll make sure to have like kind of a final version of this that you guys can vet it and be good with that. So
Okay.
Sounds good. Yep.
All right.
Anything else, Anthony, for your health director's report, or Catherine, anything else?
Catherine, was there anything else that you wanted to cover? I'm just going to run through the budget because we're only making a couple changes to it. There isn't anything major that we're making changes to. But Catherine, was there anything else that you wanted to go over?
No.
Okay, perfect. Health director's report. We kind of touched on most of it already. The only other thing I will mention for the health director's report is we've been working very closely with Liz Parsons. So she's part of the National Alcohol Policy Institute. She also lives in Melrose, so she's very local. But she's sorry.
Is she in our town?
She's Wakefield.
Yeah.
Oh, she lives in Wakefield. Oh, sorry, Wakefield.
I was paying it. I'm awake. I'm awake.
Oh, you're still awake. Okay, that's good. Yeah, so we're working with her very closely. Obviously, April is Alcohol Awareness Month, so we're starting a little bit early this year. We want to kind of start doing some planning, and we'll kind of bring more information to the board as we get it. But right now, just very initial planning stages. There was a report done in December of 2022 that kind of went over Massachusetts as a whole, how we're doing in terms of alcohol. And I'm sure some of you have seen it already. It's not good. So I think we're as a region locally, I think we have a lot that we can do, obviously, as part of our education programs that are already going right now. So I think we can plan to make some big statements in April. Make sure to bring that to attention. So more to come on
And-
that.
And Anthony, as I'm writing the Stop Act grant as we speak, that we're gonna get a letter of support from Liz's organization for this grant proposal. And she's gonna help us with kind of fine tuning, because this has a lot to do with alcohol policy, and
Right.
so that'll be helpful to have her in that role now.
Great. Yep. Good to have friends in the region working on that stuff. I think that's pretty much it. So if you guys still have the stomach for it, I'm gonna run through major changes of the budget. Laura, you're gonna fall asleep there. So let's keep this short and sweet. Nothing major, no major changes. I think there's still going to be discussions about, obviously ARPA is one of our major funding sources right now, but the town knows that there's ways to kind of fund things. We also have a bit of a question mark when it comes to our opioid settlement funds. So we're starting to receive them as they come in. We received 1 or 2 infusions of this recently before in late 2022. We've already received a couple of infusions of money, but the new Walgreens and Walmart settlement just came through. Well, not come through yet. We still have to sign for it, to join in as a community, but that will be coming down the line at some point. And it's quite a bit of money. They've already released the proposed schedule of disbursement. So, just more funds that we can put towards prevention work. There is a bit of a focus on opioids, but we do a lot of prevention work that ties all these substances together. So that funding will play a role in kind of how the town sustainably helps us fund our programs as we move towards a town budget. But in terms of that, we haven't made any substantial changes to our budget. We've increased a couple of lines. Let me just see. We've actually had a slight decrease in professional services due to the new regional agreement with Stoneham. So myself and Aaron and Melissa, our salaries are slightly decreased in terms of impact for Wakefield budget.
Does it come up to about 20? I think I remember Steve Mayo talking about the benefit. It seemed minimal to me, but
I think it worked out to be like 18 or 20. Yeah,
okay.
I think that was pre-working out steps and colas and all that stuff. But yeah, I think it's roughly 18 to 20, I believe. Actually, you know what? It comes up to about 18 for this year. No other major changes. Our telephone bill is going up. We do want to keep in mind that our PHE grant is going to be running out next year. So PHE, or the Public Health Excellence Grant, that runs out fiscal year 24. So that's June 30th, 2024. So that's the final year of the 3-year grant. I believe there is going to be a renewal process for another 3 years, but we don't know what that looks like yet. Elaine, don't give it away. But
well, they just talked about that to us. Mass Public Health nurses explaining to us how there's money in that grant, the legal department telling us about using money for that. But they claim that there were a lot of people who did not even apply for that grant, and they really and truly believe that the ones that have done well, and that you will see renewals come back. They told us that.
Yeah, we've obviously had a great success in training new inspectors. That's kind of what the focus was after they kind of changed around some of the priorities. Inspectors were kind of a big focus of that, where we have 2 great trainees that have been with us for a little bit now, I think 4 months now. So we're hoping for renewal, but that grant also covers a large portion of our training for all of our inspectors in the region. So it looks in our budget like we haven't spent a lot on training, but that's because we've been able to pay for it through grants. So we've asked for a very slight increase for travel inside the Commonwealth, which is travel towards trainings and stuff. that's just an anticipation of the grant moving away. But again, we've managed to not spend a lot of that in the past just because of grant availability. But in anticipation of that, we're increasing that slightly. We've been evaluating the effectiveness of our current inspectional software, WinWham. It's definitely a challenging software to work with, especially in a time of cloud-based programs. So we're looking to explore other software to do that, and that might actually affect how much we have to pay for it. We potentially could be paying less for it in the future. So we actually decreased our reproducing a computer line item, just in anticipation that we might be able to substitute WinWham for a more cost-effective but more effective software. Dues and memberships, we also asked for an increase. Did we ask for an increase? No, actually, no. We kept the same for our dues and memberships, but we're going to be keeping an eye on that just because of the grant going away that pays for some of our memberships. And yeah, that's pretty much it. The ARPA and the opioid settlements will continue to be kind of like a thing we're working through, but we definitely know that there's money out there. So we'll work with the town to kind of figure out what the most sustainable way to pay for all this is. So yep, but yep, that's the highlights. If there's any other more substantial questions, definitely have time between now and town council.
Good job, Anthony.
Good,
Thank
very
you.
good.
Okay. I think the last item, and it can be something brief, is something that I had asked that we discuss about the construction of the vocational school. I'm sure you guys have seen around Wakefield the yard signs, Save the Forest and Keep the Vogue. I'll admit to not really understanding what that meant for a while, because it didn't make a lot of sense to me. But I recently was forwarded an email from a friend who is supporting that group, and they have several points why they think that the Vogue shouldn't be constructed where it's planning to be constructed. And as far as I know, like, I think things are going ahead and like going forward. The one thing that kind of gave me pause was whether it was truly ADA accessible, as far as like how it pertains to us here. I'm guessing that it is. I'm guessing that the plans have all been approved by the people that need to approve them. But that was the one point that this group kind of brought up that seemed like it might be something that we may want to consider. It seems like where the new Vogue will be constructed is going to kind of be up on a hill, and there's a ramp to get folks that can't or are unable to use the stairs from the parking area and the athletic fields to the entrance. And there was concern, these folks, one of their arguments was that there was a risk that that ramp may not be appropriately maintained in the winter when there was ice and snow, which seemed like something the school should kind of be in charge of doing. Like any building needs to maintain their entryways. I don't know if anybody else had heard anything or had any other thoughts about this, or.
Well, actually, I'm glad you brought that up because, well, Catherine's still here. We can talk about the CHII grant. So not necessarily an ADA compliance specific grant, but it is about health inclusion, and it focuses on physical mobility. I wonder, even if it's not funding that we put towards it, I wonder if there's a conversation to be had about maybe we can leverage some of the things we find in our assessments. So with this, I'm just not sure if we have that planned, but.
We can also, Bill Renaud, the town's engineer, is the ADA officer for the town. So that could be a good question too, Candace, too, because he's going to be part of choosing, along with the Disability Commission, choosing which projects we assess. So, I mean, that could definitely be.
I mean, that will still be in the planning. I mean, I don't know that it will be done by.
No, yeah, I don't know if it's.
I think it's an interesting concept just to kind of give the message that we're paying attention.
Exactly.
You know, clearly, I can't imagine, though, we can't assume anything that, you know, this stuff has to be code. even so, you know, even the ramp going up to the post office, I can't actually imagine myself in a walker getting up that thing. I mean, any ramp, you know, it's still up. But, you know, universal design is that we think of everybody, and I think the minute you start walking around with a stroller, you kind of get it. But I wonder if it's more, you know, we're listening as well. I think we need to kind of assign some ears. So, you know, I'm sure sustainability is keeping an eye on it. The building committee itself. I mean, I have to say, I watched the presentation to town council to kind of explain why it got there. I feel like they could have been a little bit more nuanced in their answers. And there's been a lot of meetings since. I mean, it's very interesting walking up there now, even in the warmer days this winter, there's an ice flow that naturally occurs on that ledge. And I have no idea if the building, you know, I mean, we just don't know. But I think also that,
yeah, it's an area too, that particular football field. I don't know if anybody's really knows, but our Relay for Life for American Cancer, when we had to move, that's where we relocated. And now
Right.
because of that little hill, we use golf carts to transport the
Right.
people to come up. And it is a
Right.
difference, but I read an explanation about why they had to do that and what they were going to do. And it sounded like they knew that that may present a problem, but there was nothing specific. That was the only thing I couldn't understand, because to me, that's it's a very steep incline too. Or was it going to be leveled off more? I couldn't understand it, but I do think that if you do ask the building and ADA, I think that's who's gonna really be the ones that are gonna have some more answers for us when the planning comes a little bit more closer.
I think maybe it's just something we should be paying attention to. This group raised a bunch of concerns that don't really seem as pertinent to the Board of Health, like questions about certain species and like
Yeah.
whether the place was archaeologically significant. I'm not really sure about that, and I don't think this is
that's
the
really
place
not our
to talk
domain.
about
I mean,
right, but ADA
mean-
kind of seemed like something that we should sort of, that pricked up my ears, so I kind of thought
yeah,
that
I
maybe.
just, I can't imagine that I mean, first of all, they can't get permitted without doing it. I mean, the ADA zoning is so specific that,
But like you said, you know, maybe we shouldn't be assuming.
true,
everything. Yeah.
yeah. You know, and I believe you know, that maybe we should just say to conservation, hey, what are you looking at? What are we looking at? You know, we're all watching. And I don't know. And you know, it's kind of a watch and wait, but also inquire, but it's such a complicated system with so many different partners, but we are you know, it is in Wakefield soil, not Saugus. So I guess it is our purview, but
Just something to keep our ears open, I think, on something to kind of, to bring attention to.
yeah, I agree.
All right, anything else? Laura, Lillian, anything else? Anthony, anything else?
Oh, one thing. You've probably seen this as well, Candace, but someone actually called the town. So I got a notice from Melissa. I think she probably sent it to you as well, is that people are actually calling town hall asking, like, you know, if we can do anything about the Adderall shortage. So we've had shortages on several things. I've talked to some colleagues across the country, and you know, there have been antibiotic shortages, there have been
Tylenol.
IV Ativan shortages. The Adderall shortage is interesting. And so my only thought to Melissa was, you know, first of all, I did a little education on kind of what state of the art is right now. We have been getting it. We had been promised in the psychiatry industry that things would be better in the spring, and actually they appear to be worse. And we just have supply chain issues. Plus, we also had a lot of COVID time for people to self-diagnose themselves and then get some loose interpretations of diagnosis through some telehealth issues. So it's a public health issue, in that we may have people out there who are being medicated inappropriately, and then we have people who require medication who aren't being able to get it. And my only thought was that we add this to the checklist to Senator Lewis, and that part of the issue is that the formularies driven by insurance companies are not opening up to other options. And so that's like the only political will kind of thing when we talk about the price of prescription drugs. And, you know, it's really not a local Board of Health, but certainly listening. And I just also told Melissa, I just suggested that she just kind of keep an ear, well, actually, Candace, you're the medical director for them, just, you know, keep an ear open to see if school nurses or teachers are like noticing an uptick in any behaviors because of lack of access to treatment. So it's just, you know, it's just interesting. It's, you know, that it trickled down. I thought it was very creative that someone actually called town hall to inquire. Like, we don't have a pharmacy. And this is kind of here to stay, but at the same time, it kind of goes full circle into our wake up work, Catherine, in that, you know, this is a controlled substance for a reason, and we need to just sort of think about all the things that go with that. But that's an aside, but that was an interesting thought. And I'm attending it'll be after the March meeting, but I'm attending the New England Region American Camp Association meeting. So if I hear anything, I'll let you guys know for camp work.
Cool. Since you segued so beautifully, Laurel, into March meeting, should we talk March meeting?
Sure.
Maybe the 15th, the Ides?
Is that the one that makes, I think I already wrote it down.
That's the 3rd.
All right.
Maybe we'll say 6 p.m.
Yes.
I already wrote it down.
Good for you. All right. I don't know. Anything else? Anybody? Any last words? Anyone you want to make a motion to adjourn?
Make a motion to adjourn.
Excellent.
So Laurel can
I
rest.
support that motion entirely.
All in favor of Laurel going to bed and adjourning this meeting?
Listen,
Hi,
this is being
Silva.
recorded.
Linehan, aye. All right.
You would think I would be the one that would be the most exhausted,
Oh,
right?
boo. You have no idea. I know. All right.
Good
Right,
night,
team.
everyone.
Everyone.
Well
Thank
done, everybody. Solid marathon meeting. Take care. Peace
That
out.
was solid. Love budget time. Thank you, everybody. Great work. Good night.
you.